had terrific neck pain, and she was afraid of the needles, and you showed where it was coming from. She was looking at it, skeptical, and says, this is what's causing you the pain. And she said, well, what do I do now? And you said to her, you want to do the shot? And she says, I'm really afraid of shots. She said, and he said, would you rather have the pain? Gave her the shots, and she was moving her neck. I know this sounds impossible. And she's moving her neck back and forth, and she said, this is the first time I haven't been in pain. Well, so what the heck are you people waiting for?
Well, this is common. We do this every day.
Come on, we're talking about...
The trouble with the neck is, some people have neck pain. The trouble with the neck is there's 7 bones in there. Okay, so you got 7 bones, and each one has a joint, so that's 14.
Wow.
And everyone has a ligament.
I didn't know that, did you?
The ligaments are on 2 sides, so now you have another 14. So you got 28 sources of pain in the neck, and you got to know where they are. Now, the migraine, that is so successful. I mean, I am so happy we developed this thing, because this is the only place you can get it done. Migraine and ringing in the ears and vertigo, they're all from the same place.
And TFJ.
Now, you have a question from somebody on that.
Hold on a second. You guys talk together.
Now, the other thing I want to point out, Doc, is that if I'm going in for a herniated disc, that means somebody's going to put me on a bed. They're going to operate on me. Okay, they're going to open up my back and probably take out. I don't know what the hell they do. Whatever they do, they do. Then I'm laid up for weeks where the swelling goes down, the operation, and other tissue around it is going to probably get inflamed, because that's normally on the surgery, right? So you say that to Medicare, and they say, okay, that's normal. That's back surgery. That's what you do. Then you come along.
Because Medicare doesn't understand what he does.
You come along, you do a certain number of injections in the same region, and that all disappears, and the person is not in pain. There is no bulging, right? So where is the common sense to this equation? Surgery or the shots?
It's the people who they hire to evaluate the claims. Now, I have a guy who is in his early 60s, really healthy guy. They approved a big surgery for him with screws and bolts in there, and they approved this. Then they want to know why I have to treat him. So I did a CD on him, and he was there, and I said, look, you approved this surgery. Look what you have here. You have scar tissue everywhere, and you approved it. You paid for that. Why don't you stop paying for surgery, and we'll be able to treat these people? I don't know. See, you can't get it past them, because they have a mindset that the surgery,
tunnel vision and tunnel hearing.
Surgery is well, if you need surgery, you need surgery. Yeah. No, it is not that way. There are other ways to treat these things.
I think what we have to do is we have to start a revolution against the primary care doctor. Because that's
worst.
Where they go to. I know people that have the same doctor, their primary guy for 30 years, and they go out to dinner again. And he says, I pain in my knee. He sends them to an orthopedic surgeon, which. Instead of talking to him, there's always a different way to go. There's always a different way to go. I could give you a list, anybody, of 5 people that I sent for migraines, and let them tell you why they haven't come back.
Well, Les, you bring a good point. I think politically the country right now is divided, because you have a politician and then you have another guy who's not a politician.
Right.
But the object of the game is Dr. Pannozzo is showing. I can't even say telling anymore.
No, we show it.
Channel 19 on Mondays and Wednesdays, he shows what he does.
At 6 o'clock.
That's right. Yeah. So you show what you do, and there is a difference in what you do and other people do. Now, what other people do, they do. You're not even complaining about that. But the bottom line is, you take that example, surgery and all its complications, which is fine. That's the way it's always been done. But now you have a new order of way of doing it.
You used the term of a herniated disc. Did you know there's no such thing?
I know. That's just why I picked it. Even scoliosis, Doc, is something that you cure.
Scoliosis is
It's amazing, because I've seen it. Yeah. I have actually witnessed and photographed it and videotaped it, and I saw the people.
Well, I'm going to tell people where to go.
People still don't understand that.
And they can't put their hands around.
Where are these teenagers? The teenagers that have that should be in my office in droves trying to get
every high school
get this fixed.
That's right. Every high school kid.
But they're not. The pediatricians are sending all of them to the orthopedic surgeon.
To having those cages and bars and rods.
What it does, the cages, I've seen people with scoliosis that have the cages, and it's horrifying what these kids go through. Because your life has changed. You don't have the flexibility as you had before.
I saw a 17-year-old with 10 screws in the neck right here. Can you see that? Right there.
Back of the neck.
I mean, I couldn't believe somebody would do a thing like that.
That's so bad.
It's so bad, and this was a nice young kid. She's ruined.
Yeah.
Listen, I got a message for high school coaches.
Because
I saw what you did on Channel 19. I got educated. I saw what you did for that kid.
And you were a coach, which
and I was. And if I had known you, I would have been retired.
Yes, you would have. Yeah.
I would have been retired because every pitcher coming up through the system, starting at age 9, is going to get inflammation in the back. And you call it scoliosis. It's going to come. Things like what happened to Matt Harvey, where the artery can shrink because of the swelling. All of that is going to happen simply because you're turning the upper body, and that's not normal. And when you turn it, you inflame it. Exactly. But baseball players and football players do it 100 times worse. And you are actually the cure to that procedure.
Yes,
because you remove it.
Yes, we do. And it takes 1 or 2 days. That's it.
That's it. So if you're a high school coach, ask your ball player.
Oh, you saw the kid on TV, the pitcher?
That's right. Take off his shirt and put your hands on him and send him to Dr. Pannozzo just to get looked at.
Here's a problem with that. The parents, especially if they're wealthy or semi-wealthy, they always want the very best surgeon.
That's okay.
And you can't bypass them.
You give me the parents.
And the kids are getting, I think, mistreated because musculoskeletal medicine is the way you want to go, not the surgical route, and not the therapy route or chiropractic route. Because the chiropractors don't have the techniques necessary for this.
Listen, I went on the field and saw a kid pitch to high schoolers. He's 12 years old. And I went over to him, I put my arm around him, and his parents are doctors. He's a surgeon, she's a doctor. And I said, I need your son to go see Dr. Pannozzo. And she goes, why? And I go, trust me. Just let him come. And she said, okay, they're going to bring him to you, and I'm going to be there because the kid has scoliosis. He has to. It's there.
It's an injury. See, why people don't realize you're not born with scoliosis. It's an injury that you didn't tell your parents when you fell off your bike.
But they don't know the nuances of this. And they think, well, you got curvature, so what?
Yeah.
But the nuances are so big. You have ruined the kid's future.
Well, you know what?
First of all, they're worried about their looks. That affects their
and you know how important the looks are when you're in elementary school or high school?
That affects their capacity to learn. And they're always subconscious of their appearance. So, and they know when they have it.
Oh, yeah, of course they do.
And it's always painful. And you get it by injuries. See, so... parents, you got to rethink this. What you learned about it is not true.
But that inflammation is going to slow him down, Doc. His fastball, you know, I was thinking about this the other day. Why is it that one guy can throw 99, 101?
That amazes me how someone can throw a ball 101 miles an hour.
And another one can only throw it 89, 87.
It's all parts. Parts is parts. You got to think parts is parts. All these parts have to work together.
It's like golf. You got to bring the club all the way back. And you got to keep your eye on the ball, and you got to follow through.
Yeah, so when you pull your arm back like this to throw, your spine, your neck, your COC1, and your hand and elbow are all
working together.
All involved.
That's right. And the object of the game is like you're always saying about that free motion.
Yeah.
You got to have that. If you don't have that, then you're going to throw less than 90 miles an hour.
And if you don't have that in golf, you're not going to be able to hit the ball 200
and you know, if you
yards.
can't do it, they'll say, well, you just don't have the talent.
And that isn't true.
But everybody has the same talent.
That's
Everybody has the same body.
Right. Therein lies the difference.
Well, you're a coach. When you used to see someone coming up, you could tell the difference between talent and pain.
But Les, I never had the opportunity on the medical side to bring the talent forward because of the hindrance of what's going on.
So, folks, let me tell you this. 1 second, Doc. This is important. Okay.
I mean, this is amazing stuff.
I want you to go to, it's a free app if you have any kind of phone, to see all the people that Dr. Pannozzo has helped. This is so not rehearsed, because if you think that those are real actors, there's something wrong with you.
Yeah, somebody asked me if those were actors. They are not actors.
And you can always stream Dr. Pannozzo's show on WEYW19.com. Yeah. You could see it whether you on your computer, or you can't see it on your iPhone. You can see it on your iPad or on your computer. And you will be so amazed. You can go on Facebook. You could actually see all the things he does.
The only show you can't see on your phone is Channel 19 because they use the Flash program.
Right.
All the other two you can't.
Yeah, Pannozzo.tv.
That's right.
And what else is there?
Well, that's all I got. You have the other one. I don't know.
Yeah, Manx put
Yeah,
one
I don't
in there.
know.
I can't remember.
I don't know.
Can't remember all those numbers.
But it would behoove you. You like that, right, Fred? It would behoove you before you. I'm gonna give a quote that Donald Trump said. Why do you got to lose?
Yeah.
And you know what? Think about that. That's so important. Why do you got to lose?
Yep.
You get a shot. Now let me explain to you the shot. My wife is on Decatron for swelling. Okay. This is a drug that the NFL. I'm sorry, I don't want to use the word drug. This is a shot that the NFL and the NBA and MLB don't care. You could use it all the time you want because it's a steroid that's a non-performance
Right,
steroid.
it's an anti-inflammatory
Right.
steroid. It does not put protein on,
Right.
so you don't have to worry about
It's a safe deal. And
Doug.
but the bottom line here, let's move past that already because we've been talking about that
forever.
It's the philosophy.
I'd like to do a
Oh, what, Doc?
He's getting a tattoo.
Meg says, tell them to type your name into YouTube.
I don't know what
I
it
don't
is.
know what he's talking about.
Oh, okay. You can type.
Doc, was that a text
Dr.
message?
Yeah,
Ooh,
he
very
does
good.
get them. You can type Dr. Pannozzo
I
on
can
YouTube.
read, I just can't.
You can type Dr. Pannozzo's name on YouTube, and you can come up with Manx, whatever it is he's uploading.
Tell them to type your name into YouTube.
Yeah.
I don't know what he's
When
talking
you
about.
when you go to YouTube, if you type in Dr. Pannozzo,
Oh,
all of your shows show up.
oh,
right?
okay. That-
Hey, thanks, Banks. We
Thanks,
we
Manx.
need that help, buddy.
Yeah.
We're not broadcasters either. So,
You know-
Doc,
You know what I'd like to do with Manx, because he's a coach also.
tennis
But
coach.
if we could get one of these high school coaches to work with us, then we'll put him on this program.
Yes.
And he can tell people what goes on. They're going to courses, but they're not being taught by people who do musculoskeletal medicine. They're being taught by surgeons.
They're doing
and
the same
trainers.
thing they've done for 100 years.
Yeah, they don't change. But a good coach, if you analyze what a coach needs? What does he need? You're a coach. What does a coach need?
You need your player to play at his optimum.
He needs ammunition.
Of
He
course.
needs a good player that is not sick.
Right.
Of course, but given the chance to have that player be a superstar is the difference that I'm beginning to see now.
It's a difference, right?
I didn't realize that, and I've been
Right.
doing this for 3 years with you. But it gives me an advantage.
Oh, my God. We've been with this guy for 3 years?
Yeah.
Well, he's helped me. I don't know about anybody. He's helped me.
But the advantage is there. What you're saying is a different side of
Yeah.
this whole thing.
Yeah.
Even if they come to get checked, and you find slight,
Yeah, see,
small,
if I was a coach, I would be looking at what am I offering to win? How do I win?
How do I win?
I
That's
got to
right.
have a great player. I got to have great plans on how to use that player.
that's right.
But if you don't have the player, everything goes because that's your source of winning.
When you spend $100 million for a player in football, and this guy has a groin injury, and they have him out from 4 to 6 weeks for the life of me. When I went to
Why are they off for 4 to 6 weeks?
that's what they said with a groin injury.
Injuries.
Because they don't know what to do with it. That's why.
I'm quoting you from the NFL.
Yeah.
They're out 4 to 6 weeks now.
Turf toe, 6 weeks. Turf toe.
Turf
you,
toe.
Turf toe. You know what turf toe is, right?
There's a
On the
guy
big finger.
in my gym who's 6'6", built like a Mack truck.
Sherman tank.
Okay, played for Michigan, and then played for the Dolphins one season, and he was let go. You know why? Turf toe. So he's been out of football for now. He's a little much older now. He's about 36 years old.
That's you know how fast that's treatable.
Probably in one shot.
One shot.
I don't even know what is turf toe, by the way.
It's inflammation of the big toe on the foot.
Oh, I know you know what it is. When
That's
you
a
told me.
tendon.
Yeah, it's called a metatarsal phalangeal joint.
That's what it is.
That's turf toe, right?
And you know the funny thing is, Wilkinson just signed with the Jets last year. He was out for 8 weeks because of turf toe. He had to play injured. And the reason they say he played injured is because he weighs 380 pounds. He's got to be on his feet.
Yeah.
He's got to be agile and yada, 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 yada.
And the pressure.
So instead of coming and see like a doc like Dr. Pannozzo, getting it fixed, maybe you miss 1 week. It's not going to happen.
You know
I know
what?
that. But what the
You know,
hell?
we keep talking about this, and what we're saying is true. One of these days, it's going to start cracking like a wall.
Like
Oh, yeah.
And
wall.
somebody's going to start using the service. I mean,
Well, I mean, we see it now. I mean, your office is always busy.
yeah, the thing about it is, we treat people to get rid of them. We don't want anybody coming in more than 1 or 2 days.
And
That's
folks,
it.
he does not
I only
use.
have 6 chairs in my waiting room. You know that.
I've sat out there many a times
Yeah,
and had a sandwich.
and so we can't have people waiting around like in some offices. We got to treat them, get them out of there, don't come back. People ask me, when do I come back? I said, you don't come back.
And if you doubt what we say, if you're in real pain, number one is go to any one of those websites. Look at the people that has come. Go to Channel 19, and you could see actual people.
Yeah, watch those.
And listen, if you're a coach at FAU and their baseball team wasn't too bad last year, if you want to come down, let's talk about it.
Yeah.
We'll put them on TV. We'll talk about it in the open.
I had a player from got a full scholarship from that, and the mother brought him in to me
Smart
and said,
lady.
I want you to keep him well for 4 years so he gets a scholarship. I said, no problem at all. He never complained to the coaching staff
About his pain.
about his problems.
Coaching staff
Is that
doesn't.
the
He came
third-
to me,
third
we
baseman?
fixed him up, and they never knew the difference.
Is that the third baseman you fixed up?
No, this was a football player.
Ah. So you see, maybe parents are learning, Doc. Maybe if you want to invest in your kid to go to school, maybe the NFL, MLB, NBA, maybe you should take time out
Yeah,
and have a consultation.
you see the point you're making is if you have a physical problem, you can't be great. Your
How
body will
how
not-
can you?
Your body will not allow you.
Exactly.
So if you want your kid to be a really good tennis player, you want to make sure he can do that. You know, like when I was raising my own kids, I tested them all the time. I knew how smart they were. I knew their physical capacities, what they were, before we did anything.
Are you going to go
So
get some
you
shots
can
from
guide
ball?
them, and that's what parents are supposed to do. You're
that's what you're
supposed to know
supposed to
the
do.
potential of your child and then guide them where they should be.
I used to tell parents, if you got a left-handed bowler, send him to me. We'll make $1 million. Now it's got to be $10 million. Left-handed bowler. You know, bowlers on the left-hand side of the lanes,
Yeah.
the oil is not used. It's fresh.
Oh, I never knew that.
Oh, that's right. And if you're a left-handed pitcher, send them to me. And we
Wow.
go to you. And we make sure everything's fine. And you watch me do
No,
my
that
magic.
bowling thing. That's right.
Oh, yeah. I used to be on a bowling team. I made lots of money in the bowling game, my friend. Lots of money.
Connecticut, he bowled also as a
I had
profession.
bowling alleys in New York. I could take you to them. But the left side of the lane is never used. Never
Wow.
used.
You got questions?
I got questions. Oh, yes. Let me get to the one that you wanted about 20 minutes ago. Hold on a second. Let's go here.
Which is the one he wanted.
There were some interesting ones on there. That's why we want to get to
No
them.
problem. The first one is from Jessica from Boston, who writes, I've suffered many months with migraines and ringing in the ears. They have tried everything to help me, and most have been with medication. I watched a show on your website and was shocked that you treat migraines with the neck area. Can you explain how fixing this region helps both migraine and ringing in the ears?
Well, it's because of there's in the history, if you take a history of people with this problem,
Right.
more often than not, you'll find an auto accident and maybe a bad accident, a rear-end collision,
Yeah.
motorcycle accidents. I mean, all the pressure on those takes place at the base of the head, skull, and the neck.
Mm-hmm.
So that's where all this problem is. And we have virtually 100% cure rate for migraine.
That's
vertigo,
100%, folks, not 99%.
Yeah, and vertigo and ringing. Now, if anybody out there is, if not telling the truth, call in and complain.
Yeah.
Now, most of the time, it's just one day you could do that. But if you had a bad accident and you have a lot of scar tissue in there, it takes more than one. But we could do it, and I guarantee you the result. It's the best you can get. I did the research on that, even with the anatomy at the medical school and Nova Medical School. That's South, isn't it, Nova?
Nova South.
Yes.
Yeah. Okay, I went there with the professor, and we looked at the bodies to make sure that when I'm talking about migraine, we know where it's from and how safe it is, and it meets all those criteria. And I should get a Nobel Prize for medicine for that.
You know, you really should, if you
know,
think of it logically.
It is that important because people have this stuff all over the place.
I mean, think of this logically. You should get that. I mean, think of what you've done for people's lives. I mean, you've actually taken someone who had. I've seen golfers come in. They came in the next day to thank him so much for getting his golf game back.
I think that.
I mean, come
I
on.
think that what you have left to do is what will win you the prize. I think that if you look at this logically, because people are thinking illogically, I think if you really settle down to what you do and you put your mind to it, if I'm a 8-year-old kid or 7-year-old kid, Doc, and I fall off my bike and I hurt my back, right?
Right.
When I get older, what are my chances of having migraines if I hurt that area?
A lot.
I mean, think about what's going on. You once told me when you pull a child out of the womb, because like Freddy had difficulty coming out, they had to use forceps. He still has a mark on his face from the forceps, right?
Really?
Think about that pulling action. While that vertebra is still, pink? You know what I'm saying? No, we don't know the damage that we're causing. We just don't understand it.
On the neck, when you're pulling the head. Oh, yeah, absolutely.
Amazing stuff. And the more that I see his shows,
and those are bad injuries.
Terrible injuries, and they come out afterwards.
And they call
18,
that
20 years old.
Autism.
They call that autism.
Yeah.
I don't even want to touch that one. I can't
That's
even.
what it is.
But I can't have a conversation about why you get migraines with people. You think they're going to listen to me if I talk about
I was
autism?
on the thing. I was on the golf course, and the guy who I never met before was playing with us, and for some reason the conversation went into he said, I'm going to have to leave right now. I got to take some medication. And we said, what's the matter? He said, I have a really bad migraine. I said, what are you taking? He said, well, I was supposed to go in for my Botox shot, but I was a couple of days late. I said, I got somebody. No, Botox is the only thing that works. I said, I'll make a deal with you. Here's the deal I made with him. I said, if you go to Dr. Pannozzo and you tell him who you are, tell him Les Mayer sent you, and if you don't get cured from that migraine, I will pay the next 10 rounds at Western Hills for you. Out of my pocket at $150 a shot. I will pay. He says, oh, Dr. Pannozzo. Oh, you want to talk to your son?
Your son is on the air.
My son?
Yeah. No, he's not on the TV screen.
I'm going to see him tonight.
Oh, we can't talk to you, Paul. He's going to see you tonight. Hold on. Hey, Paul, long time no speaker. Hello, Paul. This happened once before.
Hey, Paul, you there?
Yes, good morning.
Good morning, Paul.
Good morning, Paul.
I know it's early for you in Arizona.
Good morning, Dr. Paul.
Now that we got you, what do you want to talk about, Paul?
What are you guys talking about?
Well, we were talking about migraines.
We don't have the volume on him.
And we've talked about some people. We've got a whole bunch of questions.
You got to scream a little louder, Paul, because we can't hear you.
Now, Paul, I'm telling you right now, he's coming back after 2 weeks. He ain't. Yeah. He's not living up in Arizona.
Paul, why don't you hang up and then call in again? Because maybe you have a bad connection.
Yeah, because it's very low.
She can't do it from the window here.
No, it's very low.
How about? Okay.
Okay. Wait. It's getting no. All right, call back.
Call back. Your dad can't hear you.
So while I'm waiting for Paul, let me give you this other one, Doc. Sammy from Boston writes, I've been told my shoulder needs to be replaced because of all the years of construction. They call it, ready for this, Doc? Bone on bone. The pain is so bad that now my elbow feels inflamed. They want to put more cortisone in the area, but I've done this so long I don't think it will help. Can you help me explain to me how a torn ligament in my shoulder can make me feel like a knife is in me?
Well, there's no such thing as a torn ligament. How would you get a torn ligament?
Yeah.
I mean, you get a sprain. You get a sprain, but not torn.
Okay.
And by examination, you can find out where it is. And it's surprising where actually these things happen. That's why we have a standardized examination that gives us the right diagnosis right then and there. We just treat it right then and there, and you walk out with that. You saw it on. You saw it on our program.
Yep.
The people were treated that day, and their arms went up.
That's right.
And
so, those were not actors.
If you can get down to see me, why we'll fix that.
Let me get Paul's back. Hold on. Hey, Paul, how's that? Paul?
Yes.
Okay.
Well, there you go.
Now, okay. We were talking about bone on bone, which hasn't. There's no such thing as that. And now with your dad, what's going on back in Arizona as far as things that you're seeing that your father sees? Anything different? Any different types of patients you're working with?
Oh, pain is transcendent across miles. Yeah, we see the same problems here that anyone sees anywhere.
It's a good
headaches, neck pain, back pain, very common. Especially, Florida has an older population. Mm-hmm. Some communities in Arizona have an older population. The problems are the same. Pretty much anywhere.
It's the same body.
Well, you know what I'm gonna do? I'm gonna give a question.
Hold on. Let me ask Paul a question.
Go ahead,
Paul. The political agenda with Obamacare coming on, and especially in January, the change. How has the change or the viewpoint of what's going on in medical coverage in Arizona changed? Is it the same as Florida, where everybody's up in arms because of the increase in rates?
I think everyone's upset across the country because the premiums are up, deductibles are up. No one got $2,500, right? That was promised to them that would be in their pockets,
Right.
And we could all see this coming because you can't make all these promises come true with less cost. It just does not happen. So everyone knew it was coming this way, and everyone's upset for sure.
I understand that. Okay, well, now that I have both of you guys on, I'm going to ask some questions here that both of you can get involved in. We have Jenny. We have Jenny from Boston who writes, first time watching your show last week, and it was nice to see your production company asking for feedback on the show. I was amazed about the conversation the panel was having and was more amazed that your website has all of the TV shows you own. Okay. And I can see what you do in the patient room. I have been told that I have a torn ACL from doing my job at a local clinic, and I need surgery to repair it. I wanted to know what you can do for the diagnosis, if anything, and how long would it take to get a full range of motion back in my leg.
Now, before you answer that question, I want you guys to understand something. This person works at a medical clinic, works in the clinic.
Yeah, it's not a football player.
And it's not a football player, and she's in the medical profession, but she's turning to you.
Yeah, you know why they diagnose that? Because they want the experience of repairing that. That's why. So if you go ahead and do that, you're adding into the fantasy that the surgeon has. Don't do it. There is no such thing as an ACL, right, Paul? You better agree.
Paul,
Well, I would say that she might have that on imaging, but is it clinically relevant? I mean, we don't know. We don't know what's going on. I have several patients I take care of that, they don't play football. They don't make dramatic moves. They, at least on imaging, have an ACL tear or whatnot, but they don't need to do anything about it. And so, I don't have enough info to comment, but if she doesn't need to do that kind of surgery, doesn't need to have a kind of maximal performance of the knee.
Yeah, you don't need to do that kind of surgery, which is what he's saying. And most of the pain is patellar anyway. It's not ACL. The patella is in front of that. Mm-hmm. And a capsule. That's where the pain is, not in the middle of the knee. In fact, there's no pain fibers on the middle of the knee. Okay? So you can't hurt there.
Can't hurt if there's no pain fiber.
Because there's no pain fibers. Okay, so it's all in the periphery, and there's no such thing as an ACL tear. I mean, I will go to my grave saying that, the whole thing. You cannot hurt that. Anyway, for this lady, get on a plane and come and see me. We'll fix that up in no time.
561-381-5800, and that'll get your appointment.
Is that from Boston?
That one was from Boston.
Yeah, Boston.
Boston baked beans and all. Giddy up.
And let us know when you come down that you heard it on
Dr. Pannozzo show.
Okay, next.
Yeah. Next one, and it's Mark from New York City who writes, I went to your website and saw the other shows you have on there, including the shows that show how to help people in your office. Okay? I watched a young baseball player get his full range of throwing motion after seeing you. I have a similar problem and wanted to know if all it takes is what I saw. You finding his problem and using the injection the way you did. Does this work all the time with everyone?
Yes.
That question is what we've been talking about all day. Right. He's asking, Les, is that the good doctor showing, not only explaining the way we're doing now, but he's actually showing on Channel 19 how he does it. So this guy must have seen it. He's in the same predicament, but we just talked about that. If you're a coach, call Dr. Pannozzo, 561-381-5800. I want to meet him. I'll go in there and talk to him.
Didn't you wish you knew him?
Oh, man. Are you kidding me? If I knew this guy, it would have been we would have been retired. I'm telling you.
No, we can't retire, Freddy.
I created a league called the Condors of New York. Okay? I had maybe 3,000 players and coaches involved in this thing.
No kidding.
It was New Jersey, New York, and Connecticut.
Oh, you told me about that.
It was huge. We had a building. We had everything. But we didn't have anybody like you. They were sending them to doctors all over the place.
Yeah, it's a shame.
It is a shame.
It is a shame. Paul, you can jump in anytime and talk about what it is that you've experienced with these people. I have another one. This is
no. I would say the techniques work for a shoulder. Vast majority of the time, that range can come back just by directing the treatment toward the offending structure that's causing the trouble, and the results are good. I've had my own shoulder shot up, many times after getting hurt, and it's been good. But it's like real estate, location where you put the shot. But,
very good, Sid.
With the approach we use, it's pretty good.
Okay, now we got Patty from New York City who writes, I love to watch your show and want to know how can I overcome the pain in my hands. I was offered surgery to repair torn ligaments in my hands, and that the only way to fix this problem was surgery. I was so happy to hear and see that someone like you can actually find the problem with my hands and fix that problem.
I wish they would not use the term torn.
This is what she was told.
That's what she was told, buddy.
The doctors I'm talking about should not use that term, and it comes from the MRI a lot of times. And that's why they get MRIs, because they'll diagnose, say, torn.
That's the fear.
And so,
let's install fear.
So it's a sprain, and it's probably the fingers come from the wrists.
Okay.
So he's probably got a bad wrist. Now, if they're tingling in the fingers, like the thumb, index finger, that'll be from the neck. And we treat those in one day.
You know what's amazing with you two guys is someone could have, because I always bring this up, excuse me, someone could have a pain in their foot, and you tell them it's not their foot. And you fix them by giving them a shot.
That's true.
And I've seen that, Paul. I mean, I've sent one of the most talented women in town.
I'm one of those patients.
Yeah.
And the pain is in my hip. It's not
referred pain, folks. Understand that. Just because you go to a podiatrist for your ankle, you're going to wear a boot, and guess what?
You're going to help you.
Because it's not in your ankle.
It's not in your ankle.
Cause and effect on where the problem is.
The people who go for surgery bypass us.
Yeah.
But we're diagnosticians. That's all we do is diagnose where the problem is.
And you and your son went to prestigious colleges.
Yeah, and if we send people to a surgeon, you go.
That's right.
But don't go there first.
No.
That's right.
No. As we can see on
where are you going?
Next question.
Make your second opinion first. I came up with it. I should be able to read it once in a while.
Doc, the other thing is that they're going to use scary words. If I'm a doctor and I want you to have the surgery, I'm going to use torn and broken.
Of course.
And disintegrated and all that.
Bone on bone.
Bone on bone.
Degeneration.
Oh, degeneration is the newest that's the newest thing out now. Everybody's degenerative.
Let me get that right now, right, Paul? There's no such thing as degeneration. It's a repair process.
Injury changes, yes.
They're laying down bone as a repair. It's not degeneration, which you disappear. Degeneration means you're disappearing, right? Your body's falling apart. That is not true.
And what I'm learning, Paul, the more I come in the office, the more I see, because I come in a lot of times, I just surprise them. The more I see is so unbelievable. Because I'm watching it. I'm actually watching someone with pain, and it's gone.
And we don't do that just because you're coming. Because
no,
we don't know you're coming.
I just, I've done that. Look, I had a groin injury, Paul. We have so many people that are listening every week, and he cured my, I think, 2 shots, right?
Well, with 2 different areas in your groin.
Of course, let's see if I remember. There are 5 injuries. There's 5 places in the groin, right?
5 places in the groin. Yeah.
And I went to the gym the next day, and I haven't been back, and this is over a year. Okay, so let me read this one, Doc. The ones you circled, I want to get out of the way first. Zach from California writes, how many treatments does it take to replace pain in the knee for a torn ACL? There's no such thing. Will the knee be 100% after you fix it, and why does removing the pain let you get up and walk healed?
Well, because it's patellar, that's why. Okay. It's kneecap.
Right.
It's under the kneecap is where these pains are, and they're treatable just like everything else.
So explain to Zach, Doc, why he should come to you and not have to worry about getting something done in his ACL when it isn't his ACL.
Well, if he's in California, he can go to Arizona and see Paul there.
Okay, so Paul, if he's in California,
the inside of the hip joint will also cause knee problems. So you have to figure all this out. So it's a diagnostic problem. So where is it coming from?
Well, now since we have both of you on the phone, folks, these are real doctors. They're not massage therapists. And I was reading something in, I know you guys laugh, Men's Health magazine.
Men's Health.
And I'll show it to you. And they said, for all you people that think that going for a massage is going to get rid of pain and not come back, they said that doesn't happen.
Right.
No, it does not.
And it was almost, it wasn't verbatim what you and Paul say. They said what it is you have to go to a physician. And the physician is going to tell you what, guys? To get operated on.
Of course. I mean, the scary words. Let's use scary words to scare the patient.
Yeah.
And they're going to go running to
the here's what I say to people. You have absolutely nothing to lose. If you come in, he does the diagnosis, he shows you where the pain is, you get a shot. If you want to, you don't want to go out and go for surgery.
We're gonna have a shirt made. It says "Run from the knife" and Dr. Pannozzo's phone number on the back.
Yeah.
Right, yeah. Paul likes that.
Well, we have the two boys from Brooklyn Cups. Oh, you take them away on Friday.
Yeah, we put them away. We have to. They're expensive. We have to buy more.
Doc, I can't ask a question. I only got a minute left.
What do we got left? 2 minutes.
2 minutes. Okay, let's get this one fast. Okay, hold on. Here we go. Robert from Houston writes, I finally got to see the show everyone's been talking about. All right. First time watcher, long time sufferer of migraine headaches. Can you explain to me how you treat the migraine and how long does it last?
Well, it lasts forever once it's treated. Once it goes away, it does not come back.
It does not come back. That's an injury Dr. Pannozzo takes care of.
It's a physical injury. It's not has nothing to do with the ear.
That's right.
And the nerve to the ear has nothing to do with that.
All I know is I sent two people that
I
got
just
everything.
saw on my Yahoo thing. There's somebody advertising some things for the my ringing and migraine, and it's something you listen to. I mean, that's ridiculous.
Someone says to me, "Hey Wes, how can you get rid of a pain in the neck?" I said, "Divorce your wife."
Not cute.
Okay. Not my wife. Hey, folks, thank you, Paul. Thank you so much. I hope you and Dad have a great time together.
I'll see you, Paul. I'll see you in a couple hours, I guess.
What time are you leaving?
Right after the show.
Oh, okay. I want to say goodbye. God bless our troops. God bless America. And God bless everyone that has pain, because I can get rid of it with Dr. Pannozzo's help.
We'll see you next week.
Goodbye.
No, we won't see you next week.
No.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.
1230 WBZT West Palm Beach, an iHeart